Hello, my name is Carolina, and this is the administration of intradermal injection. Some of the items that I need for this video are the tuberculin syringe, vial, alcohol pads, and clean glove. So the first thing that I need to do is gather the supplies, verify the healthcare provider's order, verify the secret rights of medication administration, right patient, right medication, right dose, right time, right route, right documentation. Next, I will check the medication order in the EHR, and I will compare the medication label with the order. Now I'm going to calculate the correct dose of medication, and in this case the doctor ordered a tuberculin skin test. 5 TU per 0.1 milliliters is going to be intradermal and only one dose. I'm going to enter the room, close the door for patient privacy, perform hand hygiene, introduce myself to the patient with my first name, and I will identify the patient with his full name and date of birth, and those are the two patient identifiers. In addition, I will ask the patient if he has any known allergies to medication, food, seasonal allergies, or others, and in this case the patient denies any known allergies. And now I'm going to explain the reason of my visit to the patient. I will make sure to keep eye contact level. Hello, Mr. Lex. So the reason that I am here is because your doctor ordered a tuberculin skin test. This is going to help to diagnose tuberculin infection. I'm going to inject the medication below the skin. Some of the common side effects, those are very common, are itching or redness at the injection site. Now, while administering, keep in mind that while injecting the medication, you are going to feel a slight burning sensation or a stinging sensation. Some of the adverse effects of this medication are difficulty breathing, hive, or a dark purple bruise at the injection site for up to 3 days after the skin test. And I will inform the patient to let me know immediately if he experiences any of those adverse effects, so I can notify the healthcare provider. I will allow the patient to ask any questions. Now, at the patient's bedside, I will do my third round of medication check. I will make sure again, I will verify again the 6 rights of medication administration. Now I'm going to prepare the I'm going to prepare the medication using a aseptic technique, but first I will perform hand hygiene, apply clean glove, okay. So the first thing that I need to make sure is that I have the proper syringe. This is a tuberculin syringe, 1 milliliter, 25 gauge, 5/8. The length of the needle is 5/8 inches, 5/8 inches, and I'm going to show to the camera really quick. And this is the proper syringe, the red cap. And I'm going to remove the lid of the vial with an alcohol swab, wipe the rubber top, remove the syringe, fill the syringe with air to the proper to the prescribed order, 0.1 milliliters. I'm going to remove the cap of the syringe. I will inject the air into the vial, and I'm going to hold the vial upside down. I will stabilize the syringe with my hand, and now I'm going to fill the syringe with the medication. While doing this step, we will do it slowly. And if we see any bubbles, then we will tap on the syringe Sometimes this step might take longer, sometimes this will be done faster. Okay, sorry guys, I'm trying to remove the bubbles. Sometimes these take longer than expected. No. Okay. I have filled the syringe with the prescribed order. This is a tuberculin. This is the tuberculin skin test. 5 TU per 0.1 milliliters is going to be intradermal and only one dose. So now I'm going to bring the syringe closer to the camera so you can see that I have filled the syringe correctly to the prescribed order and there are no bubbles. Okay, 0.1 milliliters. Now I'm going to recap the needle using the one hand scoop method. And I will stabilize it with my other hand. Now I'm going to select the site of injection. So this injection I'm going to administer on the forearm of the patient. If we cannot administer the medication on the forearm, then I will inspect the upper back. So to locate the right side of injection, I'm going to place 3 to 4 fingers width below the antecubital and 1 hand width above the wrist. So the site of injection is going to be around this area. Now that I selected the site of injection, I'm going to assess the skin where I'm going to inject the medication. So I'm going to check for any lesions. I'm going to assess for any lesions, discoloration, redness, and I'm going to palpate the area for tenderness. If during my assessment, I find that the site of injection is not right, then I will inspect a different site. But in this case, it is correct. It looks good. Now I'm going to remove my glove, perform hand hygiene, apply new clean glove. Okay, now with an alcohol swab, I'm going to clean the site of injection. So I'm going to in a circular motion, I'm going to wipe the area from the center to outward for about 5 centimeters. And I will allow the area to dry on its own. Now I'm going to pick the syringe with my dominant hand using my forefinger and thumb. I'm going to remove the cap, and with the bevel of the needle pointing up, I'm going to insert the syringe. But first, I'm going to, with my non-dominant hand, I'm going to stretch the area, the skin where I'm going to inject, and I'm going to place the needle against the skin and insert the inject slowly at a 5 to 15 degree angle. And I am going to feel resistance against the skin. Now I'm going to advance the needle for at a depth of 3 millimeters below the skin. I'm sorry. I'm going to advance. I already advanced the needle to a depth of 3 millimeters below the on the epidermis. Now I am able to see the tip of the needle below the skin surface, and I'm going to stabilize the needle with my non-dominant hand, and with my dominant hand I'm going to inject the medication slowly, and we will see a wheel forming resembling a mosquito bite of approximately 6 to 10 millimeters. Now, I'm going to remove the syringe. I'm going to place a gauze. I will discard the needle in a sharp container, in a sharp-proof container, without recapping the needle. And I place the gauze gently on the injection site. I will not massage the area, and I will apply a bandage if needed. I'm going to clean the area. Make sure that the patient is comfortable, that he's feeling good. I'm going to remove my glove, perform hand hygiene, and document the procedure. Thank you.